Lesotho's national school feeding program represents effective international support that builds on existing government systems rather than creating parallel structures. This funding purchases canned fish, rice, and fortified maize meal to diversify nutritious meals in early childhood care development centers across the country, directly addressing malnutrition that contributes to poor health outcomes and increased disease susceptibility. Innovative partnerships between traditional healers and modern medical practitioners are beginning to bridge cultural gaps that have historically prevented people from accessing effective healthcare. These collaborations train traditional healers to recognize conditions that require modern medical treatment while integrating helpful traditional practices into clinic-based care. The partnerships reduce conflicts between traditional and modern medicine that often force patients to choose between culturally acceptable care and medically effective treatment. Mathematical projections based on current positive trends suggest that life expectancy could reach 74.6 years by 2100, with improvements attributed to technological advancements, better living standards, and increased healthcare availability. Even more immediate projections show potential for reaching 65 years by 2035 if breakthrough innovations receive adequate funding and political support, while avoiding the disruptions that have historically undermined health programs. These promising developments demonstrate that effective solutions exist for even the most persistent problems facing Lesotho's health system. However, transforming these pilot successes into nationwide improvements requires addressing the fundamental challenges that have created this crisis in the first place. The path forward requires confronting each crisis simultaneously rather than treating them as separate problems with isolated solutions. Lesotho's health emergency stems from geographic isolation, political instability, economic collapse, gender-based violence, climate change, and inadequate healthcare infrastructure that combine to create mortality rates shocking even global health experts. No single intervention can address this complexity alone. Yet the Mountain Kingdom stands at a critical juncture where meaningful change remains achievable through breakthrough innovations like long-acting injectable treatments and community health worker programs that have already demonstrated success in pilot districts. Behind every devastating statistic lies a human story of struggle, resilience, and hope in one of the world's most challenging environments where survival itself becomes an act of courage that deserves international recognition and sustained support.